I'm Glenn McGinnis, and this is Outburst. This week, do you see the pandemic being under control by midsummer?
I'm very hopeful that it will be, but it's a cautious optimism.
If more people start actually taking it seriously, yes.
I wouldn't say it would be under control.
Under control by midsummer? I don't think so.
We might actually start to see a fourth wave.
But first, as we move through this pandemic, the information we get about vaccines and the risks surrounding them seems to continually change. While many Canadians will tell you they can't get their first dose fast enough, there is a portion of the population who remain hesitant. So, where do you sit? Our question.
How confident are you in the COVID-19 vaccines?
I would say probably like 90%.
Why do you say that?
I mean, like my mom's a nurse. I'm currently in an undergrad for science, so I have a strong faith in it.
And you?
Yeah, the same for me. I'm very confident. I actually work in healthcare, so just, being in healthcare day to day, if we can get the vaccines though, I feel like it'll make an improvement.
Fully confident.
Why?
Yeah.
Why is that?
It's been proven that it will have 99% chance of not dying if you have the vaccine, if it's not 100%, so I'm confident.
I'm fairly confident. I mean, I feel like it's like the flu vaccine though. I feel like it will be something that needs to be boosted kind of thing. I do feel confident in it. I haven't had a vaccine yet and I've been okay. I have been in contact with someone with COVID previous when I was working, and I was even still okay. I do believe it works though.
94% confident, whatever the rate would be.
So you're saying you believe in the efficacy rate?
Yeah, absolutely. Yeah.
And why is that?
Because I think that's more scientific than anything else, right? So if they're saying it's 94% effective, then 6% will get affected even if they get the dose, right? If they get the vaccination.
I guess I'm fairly confident based on the studies that I've read. And that's the most that I can have, and the vaccines are pretty much the biggest answer that we can have, so I don't have a choice but to trust them.
Not terribly confident, but don't feel like I have another choice. So
I mean, pretty confident. I think that my few friends who've gotten it have been doing pretty good with it, and I feel like it's just a way to keep everyone safer.
I don't know. I mean, I feel confident that they're working, right? There's always going to be side effects with any drug, obviously. So we are hearing about some people having negative side effects or having blood clots with some of the vaccines. But I mean, so that's going to happen with any drug, no matter what it is. There's always going to be negative side effects for a small percentage of people who take it.
I'm confident that it's going to open everything that's closed, but I'm not sure if I'm confident in the science.
We don't know how it's going to evolve afterwards, since we don't really had the time to actually test it enough. But at least we have a way to continue, so we all have to do it, and then we'll see.
I'm strongly confident. I got vaccinated myself, and I have a feeling of a security right now. Yeah.
It's very sad to say, but I kind of follow the flow. I'm not confident and I'm not confident. I'm all yeah, let's get vaccinated and we'll see what happens. I don't think it's a bad thing. But I mean, we don't have enough history to know if it's going to work or not. So I feel like it's the right thing to do at this moment.
Very confident. Why is that? I feel there's been enough research on them. They're all government approved. They're being used by every other government, so I don't think there's a problem.
You know what? It's hard to say. It's the same thing with the flu vaccine. I used to work in the medical profession, and I worked with nurses, so I'm going to get it. I believe in the herd vaccine mentality. I think it's for the greater good. I think it's better to sort of look at society as a whole and not just as myself. Obviously, there's a risk, but there's a risk with anything. If you take aspirin, you take ibuprofen, there's still a risk. So I think it's a risk for a good cause.
I'm not sure. I think that I'm going to be one of the last people to get it because of the fact of my age. So I think that there's been a good amount of research going in before I will have got it. So it makes me pretty confident that it's going to be okay when I do get it.
When they decide whether they're going to mix AstraZeneca and one of the others, or they're going to give us another shot of AstraZeneca, and come August, they'll figure it out. I trust them.
As I hear from the news, I think it's working, and I'm confident enough that if only majority of the people are vaccinated, then that would solve this problem, I think.
I'm comfortable with it. You know, I've got the Pfizer in me, and hopefully it's working. I asked, you know, how long would it take for me to be covered? He said, well, 2 weeks, and you'll be 80% covered. So I asked which 80%.
You know, the people who've put them together are far more expert than I am, and I trust vaccines in general to do their job. I know that nothing is a magic pill, but in terms of being safe for me and my family, I have full confidence going forward that it's the best thing we can do right now.
I myself am fairly confident in the COVID-19 vaccines. I believe in science and research that has gone into it, and I'm putting my trust in those individuals, and I think it's our best way to get back to normal.
It's the best we have, and it gives us a fighting chance to, you know, get back to normal again, which is what everyone needs.
I'm pretty confident I got it, and I'm very happy that I got it. I had no side effects. I think I feel more confident. I obviously still wear a mask and follow all the guidelines, but I do think if you are able to get it, you should get it. But that's just my opinion.
I don't have a problem because if you don't have it, they say if you got the virus, you die. So that's why you need the vaccine. You need to get yourself vaccine, man.
We've heard many times throughout this pandemic how COVID-19 was a learning experience not only for Canada, but for many nations around the world. Governments had to act fast to put those mechanisms in place to keep their citizens safe and secure. But as we keep moving along, what words of wisdom would you have to offer those who govern if another pandemic hits in the future? And if so, what would you like to see them do differently? Our question.
What advice would you offer all levels of government if another pandemic happens?
To jump, as some of the other governments did, and shut things down immediately and not listening to the public whining about their restrictions. Just jump fast.
Take action earlier. I feel like honestly the fact that like Montreal was like still having everything open and like no masks during like the middle of a pandemic and like very into like June and July was like pretty crazy. Like I feel like we would have like saved a lot of people's lives if we took action a lot sooner and like listened to people rather than just like wait till the last minute to do things.
To pursue in a well-rounded communication strategy, and yeah, that's what I would strongly recommend. Although I'm not a politician, but I think as an elector, as a citizen, that's what worked for me.
I think with what happened exactly, too much traveling I think things should have been shut down like much faster. I think for any future pandemic, they're going to realize that, you know, it traveled very quickly, and to cut it off at the beginning would make the most sense.
Close sooner, I guess. Just react sooner, like Australia and New Zealand did. Just a way to stay close and keep life alive inside the country. And then
maybe don't prioritize the economy that much. Maybe try to be more restrictive in the beginning to have a less long effect rather than a short one but concise one.
I feel like they should focus more like on mental health. I feel like that has been put aside, and like the damage to people in terms of suicide, like in my close, or not even close, but people that I know, has increased so much. And I feel like we should take that into consideration also.
Be excessively cautious and actually enforce the regulations. So if you have restrictions telling people don't gather at the park in big groups of people, actually try to enforce them. Because from what I've seen looking around here, I mean, you see, and not so much this year, well, you see it this year, but more people are vaccinated. But last year, there was no enforcement whatsoever. And so that was frustrating, walking around and just seeing people kind of not really caring. seemingly not caring.
Well, I think what happened in New Zealand worked really well, you know, just the shutdown for 2 weeks completely, and then now they're doing really well and going around maskless and all that, so.
I think it's really important, like, right off the bat to take anything seriously. I think we kind of, like, want to believe that it's not true, and I think that kind of lets it get worse.
I would think through an action plan. I think we've got some learnings from this one here, so think through that. I think we've got some emergency planning established now to get us through the next one a lot easier.
I don't know. I feel like the lockdowns are not working. You kind of have to just deal with it. Like, it's like the flu. We still live and work. Like, I don't think we should be closed down.
I think being faced with a new pandemic is total reality at this time. At this point, everybody knows that anything can happen, I think. So to have some contingency plans in place for the future, I think that's important. I think it's difficult to think of while we're in it right now, but I think that down the line, of course, we should be using what we learn now to better understand how to protect ourselves in the future.
I just think kind of reviewing, if another pandemic was to happen, reviewing kind of what we've gone through in this situation, because it's not really something that many of us have experienced before, and just seeing how we can kind of tweak our approaches from this time around or adopt the same approaches. Just kind of like reviewing how this went, essentially, once it's over, hopefully.
Well, I think if that happens, I think, again, continue with the restrictions and the lockdowns within community. We have to control it. It's a very dangerous virus, so yeah, not a problem.
I'm very hopeful that the lessons that we've learned this time around will lead our politicians to be more assertive from the get-go. And I hope that the creativity that different jurisdictions have shown, particularly I think Nova Scotia, will inform public policy across the country and lead to some more predictable and clearer outlines and guidelines for people to follow in the future.
Oh, I don't know. Trust science, I think, is probably the way to go as far as responding to a pandemic.
Overall, I think we did okay. Yeah, I would just say maybe start restrictions a little sooner just so we could maybe open up or even just limit the amount of people in stores sooner. But yeah, I think overall it was pretty good.
I like the idea of playing it safe rather than sorry. It's been really successful here in all of the other Atlantic provinces, but I do agree that, yeah, with the small businesses, I wish that they could get more support as we're both kind of in that industry, but other than that, I feel like we're doing pretty good.
Well, I think the big learning curve so far around the world globally has been the fast response to limiting people's movement. The COVID-19 only travels based on people traveling. It doesn't travel by itself. So I think the best advice I would have to say is do some more of the same, but maybe earlier even, and put up with the people being mad at being restricted.
How many times has Canada hosted the Olympic Games? Is it 1, 2, or 3? The answer is 3. Canada has had the honor of hosting the Olympic Games on 3 occasions. The first, the 1976 Summer Olympics in Montreal. This is Canada's only Summer Olympics, and turned out to be the first time a host nation failed to win a gold medal. The second, the 1988 Winter Olympics in Calgary. Canada's medal count in these games totaled 5, 2 silver and 3 bronze. The third, the 2010 Winter Olympics in Vancouver. The 2010 Olympic Winter Games took place in Vancouver and Whistler, BC, with Canada winning a record 14 gold medals, the most won by a single nation during a Winter Olympics up to that time.
We've seen COVID-19 cases declining across the country, especially in areas that were off the map during the height of the third wave, which of course is encouraging. But there are also areas like Manitoba who are once again seeing a surge of cases, which leaves many people there thinking this upcoming summer could be a write-off. But with the vaccine rollout now in full swing and some Canadians eligible for their second dose, do you think that we can manage COVID-19 as we move into July and August? Our question.
Do you see the pandemic being under control by midsummer?
That's a good question. I'm not sure. I kind of feel like it might be the same thing again, but I mean, we don't know until it really happens, right? I think like everyone kind of hiding and then being exposed again, like it's bound to happen. But with the vaccines, like they're expecting it to be lower.
We're almost in midsummer now. I would say no, not really. I think we're doing it on the right track, and I think once we start to lift some of the restrictions, that we might actually start to see a fourth wave. That's happening at other places in the world. So
yes, I do. Because our numbers are decreasing, and our vaccinations are doubling.
Under control by midsummer? I don't think so. I don't think that's very realistic, just with all of the different waves going on, even when we thought it was under control. I think we have to be realistic on this topic for sure.
I have to agree. I think we kind of struggle with the gradually going back into things, and we kind of do all or nothing. So I think it's just kind of end up causing another wave.
Yes, I think so. I think.
Why do you say that? Why?
Because like all the numbers are going down, people get vaccinated. So I think we're in the good path.
I think that will be controlled. Like if everybody got the vaccine, you know, like a lot of things be happening these days now. People dying without the vaccine, you know. Like if they give everybody the vaccine, like it's gonna be much nice. And some people don't want to get the vaccine because they are really scared, you know, that if they got the vaccine and some that they might go home, they got sick or something happened to them. But I think it will be good if everybody got it.
I think that in certain pockets, the pandemic will seem under control, and I am hopeful. I'm very hopeful that it will be, but it's a cautious optimism.
I hope that the pandemic is more under control by midsummer, but it's hard to say. I think our vaccine approach is picking up a little bit with the age groups opening up, so I'm hopeful that we can live maybe a more normal life, but I think it's still going to be around for a while.
Well, I keep thinking July 1st sounds like a good way to celebrate everything. So I'm crossing my fingers that that is also the end of the majority of the restriction. I would love to be able to travel again in the fall and go see my kids and on the West Coast and go see my mother in Quebec and even our nephews and nieces in New Brunswick, who we haven't seen for a long time.
I hope so. In this province, I think we've come at it in a strong way, and you know, I think the numbers are starting to go down now. Higher vaccines, younger people like myself can now eligible to get vaccinated. So hopefully, if everything keeps going the same, then you know, a month from now, 2 months from now, we should be back to normal.
I wouldn't say it would be under control. I think we might be doing a little bit better. The cases are going down, but I would say it's going to be a while before we get back to normal at all.
I'm hopeful that we can move towards some lessening of restrictions and have some closeness with people and a bit more normalcy. So fingers crossed for the summer.
I do. Yeah, I think we're in a way better place than we were last summer. Last summer at this point, we also handled it relatively well, and we didn't have vaccines. So going forward, I think we're going to actually see that light, get to that light.
No. Because the case numbers, I guess, continuing inequality for vaccines. I feel for all the communities in Manitoba right now that are still struggling to figure out how they're going to get it. I mean, I have high hopes, but I don't know. I don't have confidence that it'll be back to normal yet.
Yeah.
What's that?
I think enough people are being vaccinated. I think the rollout it seems to be very successful. And I just think, yeah.
If more people start actually taking it seriously, yes.
I'm really optimistic. I want to say yes, but with all the variants, with how close people are getting, like I think once they ease everything and once people start piling back in together in big groups, it might go back up, but a lot of it's going to be outdoors, right? So it's hard to tell. I think being hopeful is important.
I don't really know what under control would be. I don't think it's actually going to be under control, no. I think we're just going to deal with it.
I hope so. But I think in Quebec it might be, because of all the vaccines they're providing. So I think maybe in Quebec. I'm sure it's not going to be under control in the world, but maybe in Quebec, yeah.
No.
Why not?
Because like with everything I said about like the vaccine, like we don't know how much efficient the vaccine is. We don't know nothing about like how like the borders are going to reopen or not. So I feel like there are too many variables in the short term happening that we can't say like this summer, which is in 3 months, that everything going to be back in order. I feel like it's too soon.
While COVID-19 was a body blow to our economy, our hospitals and, of course, our healthcare workers were also under enormous strain. During the height of this pandemic in the province of Ontario, when numbers were surging, we gladly accepted help in the form of more healthcare workers from Newfoundland and Labrador. We took to the streets to ask Canadians how this pandemic has helped us better understand what our medical professionals need moving forward in the future. Our question:
what has COVID-19 taught us about our healthcare system?
I think it's taught us that our healthcare system is really important. All of our PPE and oxygen is kind of widespread, so we kind of need more in each community, and I think it's kind of taken for granted sometimes. But it has shown us, the patients, and how important it is that we have healthcare for everyone here.
I think we need more people in our long-term care facilities, especially the first wave. We really saw a struggle with that. I think we've definitely done better this second/third time around. Our second wave was kind of small. I think we need some more support for mental health as well. I think we're starting to see where everyone's stuck at home. We don't have a lot of support for mental health. There has been more talks about it, but there could definitely be more for that as well.
It taught us so many things. We should be very careful about our health, and we should also take care, not just us, but to other people as well. We should be very cautious and be vigilant, because we don't want this thing to happen again.
It's essential. I think it's probably underfunded and understaffed, and going forward, not just for pandemics and stuff like this that we're probably going to see in the future, but other issues as well. I think we need to not only thank the people that are in those jobs, but give them more resources and more means available to combat issues like this.
Well, I think it has exposed a lot of weaknesses in the system. Like, I'm a disabled person, and a lot of us who are in the disability community rely on home care. And home care really is a long-term care facility that operates within communities, so it's very exposed. And at times, I know some of my friends lost home care without any notice. And when you depend on it, it becomes very, very difficult. So I think government has learned a lot, and hopefully they'll correct the thing. And some positive things as well have happened. For example, in Nova Scotia, we did not have telemedicine. We have it now. And hopefully that will continue, and especially when you're a person with a disability in the winter. It's difficult to go to a doctor's office, so if you can do it on the phone, let's do it. Continue it on.
I think COVID-19 has shown us what some of us have known for a long time, in that our health system is under strain, and that we need to be serious. If we are actually going to deal with future pandemics, if we're going to deal with increased demand of any kind for healthcare, that we need to get serious about protecting this system that we say we love so much. And actually putting our money where our mouth is and investing in it. She agrees.
I think, if anything, we've all learned that public health across Canada has really come up to the forefront and taken a lead, and even government politically have been following their advice, which is a wise decision.
I would like to see it more reaching, and more people able to get into results, and more not regulated, but to be able to organize it better, but in the way that things would run more smoothly for everybody on both sides, on the health side and on the public side.
We're always understaffed, for sure. Yeah, I've worked in long-term care homes and they're already understaffed. I already feel terrible for every one of them working there.
I think we really take for granted what the healthcare, like all those professionals do for us, and now that they're kind of our front line and we rely so heavily on them, I think that kind of opens our eyes to that.
That's a tricky question because I know that a lot of things have been put on pause, unfortunately, and a lot of people haven't been getting necessary treatments because of it, because people are either scared to go to the hospital and get the treatment, or just because, of cancellations, appointments being canceled because they have an influx of people who are coming in that are sick with the virus.
A lot of people were able to get attention, and maybe the only problematic I saw was the cases of people like not being able to, for example, they have heart problems or other type of health problem and not being able to get taken care because of the hospitals are full. But I still feel like generally, it's pretty good, for at least for the pandemic part,
That it's not reliable and it has many issues. But I mean, there was no way to prevent this, I guess. So we're all learning, and maybe next time we'll be ready.
Yeah, I think like the most important thing is that even though the COVID situation is not yet done, we still have to like learn by going and try to like improve it as we're going through the pandemic, because like we're seeing how like the system is lacking already, and we have to improve it.
For now, I think it's too early to jump into the lessons learned. I think we'll know in a year like how much this whole pandemic has cost us, not only to the health system but to like the economy in general.
That we are underfunded and understaffed and not set up for a crisis of this proportion.
It taught us that it was vulnerable, very fragile, and that it needs more input, whether it's money or people, human resources. We need to attract more workers there.
But I think everyone else now is really aware of how faulty our system is and how short-staffed we are with nurses and how underpaid they are, and that affects everyone in the city, not just the people that are working in healthcare.
Salaries need to be better, job security needs to be better, and there needs to be a better support network. But that's not to discard all the work that doctors, nurses, and support staff, ambulanciers, that the whole réseau is sort of taken care of.
Thanks for watching this episode of Outburst on the Cable Public Affairs channel. I'm Glenn McGuinness. If you have any comments about this show or any other show, you can find us on social media. You can also find us on our website at www.cpac.ca. It's your turn to speak up, and we're listening.